Posterior tympanotomy accesses the middle ear space directly from behind. It can also be called a facial recess approach because it opens into the facial recess of the middle ear. It's useful for accessing middle ear disease located in the facial recess and sinus tympani regions. It's also necessary to access the round window niche during cochlear implant surgery. Other indications are as part of a lateral temporal bone resection to free up this part of the specimen, and during facial nerve decompression surgery to locate the vertical portion of the nerve. The boundaries of the posterior tympanotomy are the mastoid facial nerve trunk medially, the chorda tympani nerve laterally, and the incus buttress superiorly, which is a buttress of bone left behind to preserve the incus's attachment in the fossa incudis. The basis of a good posterior tympanotomy is a well-prepared cortical mastoidectomy with good access, a properly thinned posterior canal wall with no air cells remaining, a visualized incus body, and a relatively flat strip of bone at a depth just superficial to the lateral semicircular canal. In this screenshot, you can just appreciate the yellow of the facial nerve trunk and chorda still covered in bone. In reality, it is usually not so clearly seen. The bone between these two nerves, shaded, is what needs to be drilled through to perform the tympanotomy. Typically, a size 2 diamond burr is used with copious irrigation, and the tympanotomy is developed in line with the incus short process from superior to inferior. The surgeon is aiming to chart a course through the bone between the chorda and facial nerve trunk and straight through to the middle ear. Directing the drill too far from the nerve trunk risks damaging the chorda, as shown. And if drilled further, the annulus or even the ear canal can be damaged. Conversely, directing the drill too deep risks encountering the facial nerve trunk. If the bone is well pneumatized, it can be relatively easy to complete, although following air cells and solely relying on them to show you the way can never replace a solid appreciation of the anatomy if one wants to avoid complications. If the bone in this region has no air cells, then drilling the tympanotomy can be a hairy ride, but one that must nonetheless be taken. If in doubt, stop and review your anatomical landmarks. A nerve monitor can be useful, but it may also confuse. Again, there is no replacement for a solid understanding of the anatomy. Here, the tympanotomy has been completed, and we can see the round window niche. Once through, the tympanotomy can be widened, though this is limited by the narrowing to a V shape inferiorly as the chorda meets the facial nerve trunk. When drilling ridges of bone medial to the tympanotomy to gain better access, beware of the shaft of your drill and take care not to inadvertently heat the facial nerve trunk by holding the shaft away from the nerve. Here now we see the inferior facial trunk, the chorda tympani, the rest of the mastoid segment of facial nerve, the round window niche and promontory, the incus buttress, the lateral canal, the tympanic or horizontal facial nerve, its second genu, where it becomes the mastoid segment. For demonstration, let's see what happens if we were to drill too far forward through the chorda and onward. This would lead us eventually to breach the ear canal or annulus, an undesirable result. Here is another demonstration of this procedure on a different bone. If we remove the incus buttress, thereby drilling away the fossa incudis bone, this reveals the short process of incus in its entirety. And now it's your turn. Drill 5 left and 5 right posterior tympanotomies on different temporal bones on your Voxel-Manual simulator.